The disease we know as AIDS is changing the face of the African continent. Without the life-saving treatments available to people in the United States and Europe, thousands of adults and children are dying each day.
It is estimated that 40 million people in the world are living with HIV/AIDS. Nearly 3/4 of these people live on the continent of Africa. You will hear stories that reflect the perspectives of people in 2 cities in East Africa, Nairobi in Kenya and Dar es Salaam in Tanzania. But these 2 cities are typical of nearly all of the urban centers in Africa, and the spread of the disease in the rural areas is even greater. In Dar es Salaam on the coast of Tanzania, we will join staff members from an organization called PASADA as they reach out to the poorest victims of AIDS throughout the city. In Nairobi, we will follow medical professionals and community volunteers through the slums of Matare Valley and Kariobangi as they attempt to relieve the suffering of people living with AIDS in extreme poverty.
In my rural village, I had a farm. I planted cabbage and took it to market, and we managed okay. But then I got sick, and now I am helpless, which is hard for me because I am a person who likes to work. So my own mother came to the farm and brought me here. She carried me because I could not walk. I could not even speak. It seems like the life has just gone out of me. God gave me 4 children. 3 have died and only 1 is left.
What I've recognized about my patient's daughter, the child is living a very poor life because the other children passed away, and also the child can recognize the condition of the mother is not good. Sometimes it is hectic to me because I'm trying to solve their problem whereby I can't solve their problems and mine. When I combine them, I'm in a situation whereby I can't do much than what I can do.
The tragedy is those who are being infected with AIDS, the largest percentage of them will have very little access to care. They claim over 50% of all hospital beds in the city of Nairobi are with HIV-positive patients. There's a larger infection rate within the rural areas. And what it really seems to be going on is that the poor are basically being left by themselves to deal with the issues of AIDS.
My great worry is that I do not have somebody to care for me. I have no child, no mother, no father. I have no one. You see this house? It's so broken. When the rain comes down, I just sit like this in my pain.
Most of them will die, okay, but they are not supposed to die suffering. She is in pain, but you can relieve the pain by giving something. Because if you leave her at that time, that is the most time when she needs somebody.
There has been a massive breakdown in healthcare in Africa, and Kenya is a very good example. We hardly have a public health system in place, and so people who to a certain degree in the 70s had some access to healthcare have nothing to fall back on. So they are sick, they are poor, they don't have enough to eat, and the HIV virus has a field day. The largest number of people infected with the HIV virus are young people between 15 and 19 years old in this country, between 25 to 35%, which means, in a very terrible sense, that a generation is dying away, and with them their children as well.
AIDS has affected every aspect of life in Africa. You know, we have to remember in the U.S., we're still talking less than 1% of the population. And in Africa, I mean, we fight about the statistics, but, you know, whether it's 10% or 20% or 30%, it's so enormous that people begin just shutting down emotionally because there's so much death. We take a city like Dar es Salaam, we assume 3 million people, and I think people are generally talking 300,000 to 500,000 are living with AIDS. The good news of the work that we do is we're reaching, 6,000 people. But what about the other 294,000 people that there are no services for? What about the people that our home care isn't reaching out to, that are dying alone? Our social work staff went to this very simple home where 3 boys were living. The mother had become very ill, and once it was suspected AIDS, the father just left. Several months later, the oldest son, who's around 15 or 16, literally carried the dead body of his mother to the hospital after holding her as she died with no medical care, no community help, nothing to ease the pain, nothing to help these kids. These are 3 boys. They have nothing. 4 concrete walls that are cracking, a single bed for 3 teenage boys.
It would have been nice if our mother had built a house for us while she was alive. That would have made us feel proud because we could have told people, I'm going to my house now. People say to us, your mother has died. What has she left you? This bothers me very much, to such an extent that I start to cry.
Since the time when our mother fell sick, we did not go to school. This little one, he's 8 years old.
He doesn't talk, for his tongue is a bit tight, and when he tries to talk, he babbles.
Sometimes you try to love them, you will not know if they really are receiving your love because sometimes they don't talk. At least even if they have problems, they realize there are some people who care. And there are sometimes when they come, they share with me their problems. Sometimes I help, sometimes I can't help, but that time we spend together, make them feel at least there's somebody to listen to me.
I myself have a talent in singing. With this talent, I have hopes of supporting myself.
AIDS has totally destroyed traditional African social security. Whereas you age, your children will take care of you. Well, with AIDS, we've lost a whole generation. So we have this group of very elderly African and often African women who expected to be taken care of and now have children to care for and to try to feed and keep her grandchildren in school. But she has no money.
I look at these children and I say, what do I do for you? Where are we going to live? There's no food in the morning. There's no food in the midday. We have not eaten a thing today. Sometimes we sleep without eating. Only when grandmother has some money, she buys bananas or papaya or cashew nuts. That's it. Sometimes there's no food and no clothes. And the rooms in the house are in very bad condition.
The influx into Dar es Salaam from the rural areas is enormous, and it's on a daily basis. I don't know how many hundreds or even thousands per day come into the city. The number living on the poverty level in Dar es Salaam is something like 60%. That's a very big figure. So that even those who have saved a little bit, one severe illness is enough to wipe out their life savings, you know? And that is what is happening, that people in fact have nothing. And they are expected to not be dependent on others.
To tell you the truth, what I'm seeing, the levels of poverty that I'm seeing today was not something that I grew up with. It was not there in the 60s and it was not there in the 70s. The massive numbers of poor people is something that has come up in the 80s and with the 90s, and it is directly, in my view, a result of some very poor economic plans that were imposed on governments. The IMF, the International Monetary Fund, and the World Bank came with the very brilliant ideas of brilliant in quotes, I'm sorry to say, of structural adjustment programs, which forced governments to cut down on their social services to the people. And as I said, the first thing that went was health, followed by education. And the impact on the poor people has been incredible.
I've spoken to people from the World Bank. They blame all the problems on the countries. They say, well, corruption. And I agree with them 100%. Part of the problem, the economics, part of the problem, the health system, is the corruption inside a country like Kenya, which is well known and documented. And so part of the healthcare money is lost. That's an issue that has to be addressed. But there is another issue. Even if you remove the corruption, you're still not going to have enough money for the level of poverty in the country.
The sheer numbers of people involved is so great that there has to be a worldwide effort to restore the peoples of Africa to some sort of level ground and begin building up their economies again. Without that, I see that the problems of this continent will reach a point where there will be animals and not people in this continent, basically, which sometimes look like it's the purpose of the developed countries to depopulate Africa. Yeah.
Walking down to an informal school is a basic challenge. You plan ahead and you contemplate the possibility of being attacked, so you don't carry your watch, you wear very cheap shoes and cheap trousers, because at the end of the day, it's not that you reached 10 schools in a day, but somewhere down in Mathare Valley, a child in an informal school whose mother is very sick and whose brother is abusing drugs has got something about the risk of infection.
For those who don't know me, I'm the famous Mr. AIDS.
Empowering young girls with this information is empowering an entire generation.
And for you, dear, this is your time. Come to me, don't you afraid, come with me. Oi, 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 shida so young.
Giving the girl that basic information where they can influence sexual decisions about their own lives and are able to impart this even on their children if they will have children. With all my education, with all my training, some people ask me, why don't I get a better job? For me, this work is not something I do to get a salary at the end of the day, but this is something I do because I believe it's a calling. I'm doing it because it's not because somebody has to do it, but because I feel I am the one to do it. We appreciate the concern of North America and other Western nations as concerning their need to protect their populations, but we also would like them to pay more focus on the plight of people like these children here. I think it would cost more to test a fighter jet for a half a minute than to feed a child here for a whole year. So let us make wise policies, not as a specific nation, but as a human race.
Traditionally, there have been no orphans in Africa. All children belong to somebody. Even if a parent, an actual biological parent, passed away, there was always somebody to fill in the gap for the child. The extended family is the only social structure, the safety net for Africans. We don't have a very good social security structure in place. But with the advent of HIV/AIDS, the number of orphans rose so fast There were so many children who suddenly were left without protectors. The most abject of these children were the children who were actually infected with HIV, because there was the fear, the stigma, the chronic illness, and we felt that these children would suffer most. So this program was started in a small way to address the problem of children who were HIV positive and had absolutely nowhere to go.
What is the future of these children? Who is to blame? Why does this have to happen to them? We are losing 700 Kenyans every day. Every day to AIDS, 700. And that's a big number. Let us not look at the figure. Let us look at the faces, because at the end of the day, this figure represents faces. They are my brothers, they are my sisters, they are my mothers, they are my fathers, they are my relatives. And every day as a country, we are losing 700 because of a disease called AIDS.
George is one of those who had a long bout with this disease. You can see that he's got redness of mouth, and they get very severe pain in the limbs, extremely severe. In fact, I give them a combination of drugs, but they are still in agony. It's a crime for drug companies to put the prices of life-saving drugs out of the reach of the great majority of humanity. So that issue of patents for drugs that are life-saving for large numbers of people who will obviously not be able to afford those drugs has to be addressed. And it has to be addressed at very high levels, I hope at the level of the WHO or the United Nations, so that there has to be, we understand that the drug companies have to operate and have to get money to continue more research and all those other things that have been said again and again. But again, we can't have millions of people dying because they don't have access to those drugs. And I hope, it is my great hope, because these drugs do change the whole face of the HIV epidemic. It gives the patient hope, it gives the relatives hope, it gives the health givers hope, and everybody is suddenly looking in some sort of direction instead of being struck completely helpless by this epidemic.
That's a good girl. You know, they're normally so unwell that any slight sense of well-being is not immediate. So she says she feels quite well.
I think the number that people say are orphans is grossly underestimated, because I think there's the country is saying that maybe about 1 million orphans. Must be more. Must be more. I'm not very good in figures. So we say that statistics are numbers with the tears washed off them. And I think we're dealing with the tears. I try to think of ourselves as pillars or something that people can lean on. And you know, I was brought up on Winnie the Pooh, and I have a picture which I had on my office desk where Christopher Robin is leaning against the bear, pulling his boots on, and he's saying to the bear, "May I lean on you while I pull my boots on?" We are here for someone to lean on for a while.
I have hope. I believe that there is a genius in people that will help them address the problems that face them in the times that they are living in. I have hope because, maybe I have hope because I'm a pediatrician, or I'm a pediatrician because I have hope. To look at the face of a little child because you have made a difference for another day gives me hope. I have hope in the African people, but I have specific hope in the African woman, that in spite of these difficulties, they are keeping families together and supporting children and going out and hustling around to make a living. I have hope that people are good. Basically, intrinsically, when you look into the hearts of people, there's bad things, but also a lot of good things. And I have hope that people who share this world with the rest of us will look and see another child starving in the Sudan or another child dying of HIV in Africa, and one day say, no, it's too much, this is enough. So I have hope. Yeah.